UKIP would keep the NHS free at the point of delivery and make no cuts to frontline services. There is a big thing that's going on in the NHS, which is to do with Quangos. Quangos soak up a huge amount of money. The people who run the Quangos get paid enormous salaries. You're talking at £200,000 some of these people get paid. You could actually cut the Quangos out, cut those layers of management out, which all previous governments have put in place. Return the hospitals to county health boards. Get the hospitals to run on a local level. Cut out these extremely expensive managerial positions. Well, we could introduce private sector franchise partnerships to run NHS healthcare services better, while assets remain in public hands. Introduce health credit vouchers to allow people to opt out of the NHS if they so wish. Re-examine community care and support congregate communities for people with learning disabilities. Restore free NHS dental checkups and eye tests.
Labour are really proud of their record on the NHS, and I wonder if they're right to be so proud. We've seen over the last 13 years a massive expansion in PFIs in the health service, and I don't think the record of the PFIs, the Private Finance Initiative, is really a record to be proud of. It's proven to be a very, very expensive mechanism for putting some new investment into the health service. It's complicated to run. I think it's one of the things which has contributed to the big expansion in the number of administrators in the health service. And times are tight. Times are going to be tight for all of us in the future. At the moment, this government is spending £4 for every £3 it raises in taxes. So times are going to be tight. We are going to have to look at the cost of administrating the NHS in order to put more money into frontline services, which are the frontline services that we are all going to need. Thank you.
Many years ago, I was on the Health Select Committee for 10 years. Been all over the world looking at different health services, and at the end of the day, always came back to the view that our health service is the best in the world. Could we start it again with people's expectations? It would be jolly difficult. But I have to say to each and every one of you, there is no limit today to the number of treatments that can be given to people. And with those treatments, there is enormous cost. So although my party will more than match the present government's spending, it is always going to be very, very difficult to match people's expectations. And what I'm very frustrated by, Chairman, is I am not happy with the way that our management is carried out in a number of our hospitals. There are too many people who I think are giving instructions which I find very, very wanting. I want it to go more to frontline services. And I also think, Chairman, in this day and age, how is it that we're no longer able to deliver cleanliness? I mean, these are simple basics. So I do think that whatever we spend in the National Health Service, there will always be constraints, but I totally support the National Health Service.
There are still problems. I actually agree with David on some of the management issues. My mother works as a community nurse, and I hear daily the stories about how bad things can be on the front line as a result of a level of management which doesn't understand the needs of the NHS. I also am proud to say that Andy Burnham, our Health Secretary, has finally acknowledged, thanks to lobbying from many people here, I'm sure, and from many of my colleagues in the Labour Party, to allow the public sector to take on contracts that previously were only available to the private sector. And I'm glad that we will not see the NHS run by the same motives for profit that brought down the banks. And I'm delighted that the Conservatives have health as a priority this time. It was our priority in 1945 when we created the health service. It was our priority in 1997 when we saved the health service, and it's now a priority today as well. Thank you. I recently signed a pledge, one of the many that I've been asked to sign over the last few weeks during this campaign and throughout the year. I signed a pledge on the issue of how teachers are, the safety and the dignity of teachers in the workplace. I would ensure and would work very hard to ensure that teachers, like everybody else, gets a chance not to be bullied, because at the end of the day, some teachers do get in a situation where the kids can play up and so on. And what we need to do is to make sure that teachers, like everyone else, get the chance to work in a safe, healthy environment, and I will do whatever it takes to make that happen. But that doesn't, I'm afraid, include corporal punishment. I don't believe in a society where we use violence on children or indeed on anyone else.
I can show you my party manifesto afterwards where we say there's a crisis in discipline. We will give teachers the tools and powers that they need to keep order in the classroom. We will abolish appeal panels so schools have final say on whether to exclude a disruptive or violent pupil. We will reform the pupil referral unit system to encourage excellent third sector organisations to get more involved, and we will give head teachers the power to ban, search for and confiscate any items they think may cause violence or disruption.
Yes, I wouldn't advocate a return to corporal punishment. I do think discipline is essential. I think often society, often politicians don't give enough respect to teachers, and perhaps that's one area where we ought to reverse the trend. I think what teachers would like is respect from politicians, and they'd also like smaller class sizes, because if you're a teacher with several unruly children in a class, you're in trouble. If we can bring down class sizes, especially for younger children, then I think we can move a long way forward on discipline, and I hope we can. Thank you.
When I went to school, they did operate the cane. I never went to school in fear of the cane. Sorry. I never went to school in fear of the cane. I never received the cane because I did as the teachers told me. We didn't think we were being abused. With rights come responsibilities. Children today know that the teachers and the police could do nothing about it. They can misbehave and nothing could be done. So what you could propose to do is restore the authority of head teachers. Restore their authority to exclude, restore their authority to expel, and yes, we would look at restoring the authority for schools to use corporal punishment if they wish to do so. It's something that's been, before 1998 we didn't have a Human Rights Act, and we had perfectly good rights and protections under the British Constitution, which seems to be a forgotten freedom in this nation. We had perfectly good rights before these things came in. So I think restore the right of schools to discipline.